Yes.
All right. So yes, so I was talking about how do you know that someone is addicted? And according to the ICD guidelines, we use a particular criteria. So it is not everybody who drinks alcohol. It's not everybody who smokes substances. It's not everybody who takes tramadol or opioid that is addicted. And there are certain criteria and certain guidelines that the person needs to meet before we say that the person is dependent. And loss of control was one of the ones I was talking about, where loss of control in terms of frequency and quantity of use. And then tolerance, where the effect that you used to get from drinking one bottle of club, now you need to drink two or three in order to get the same effects. Then withdrawal symptoms, when you momentarily abstain from using the substance, you begin to get certain symptoms. Psychologically, you may get an intense cravings for the particular substance. And then harmful use was where I got to. So with regards to harmful use, we are talking about you are using cannabis, and yet you know that physically, emotionally, and socially, you are being affected. You go to work and then you cannot effectively work and contribute meaningfully to society. Social effect. Yet you are still using the particular substance. Physically, you have done some labs and noticed that your doctor has advised you that your liver is being damaged. But you know that you have a damaged liver and yet you are still drinking alcohol. Your doctor has told you and you have done some tests to see that your lungs are gradually being damaged, yet you are still smoking. This is the use of the substance despite noticing harmful effects. And another area of this harmful use is in terms of interpersonal relationship with people, in terms of your functioning in the house. The other one is rapid reinstatement. So you stop using your particular substance for a period of 2, 3 days or 1 week. Then you decide that, oh, okay, this time I'm going to go back to the use of the substance. But as soon as you go back to immediately the same pattern of use. Meanwhile, with that pattern of use, at a day you were taking like 4 bottles. And from the time you started drinking alcohol to the time it took you to 4 bottles, it was a long time, maybe 1 year, 2 years. And you stopped drinking for like maybe 1 month, 2 months. And then you go back to the use of the alcohol and immediately you climb up to 4 bottles or even 5 bottles. That is rapid reinstatement of the amount of substance that you were using earlier. And salience of drug use. Salience of drug use has to do with everything about your life is centered around the particular substance. So the substance becomes the prime focus of your life. You are walking, you are thinking about the substance, you are in church singing, you're thinking about the substance. Your entire daily activities is centered as to, oh, when am I going to smoke next? When am I going to drink next? This is what we call salience of the drug use. And you notice that all of these substances, the guidelines say that if you have at least two of any of these, if you have at least two of any of these things, then you are at dependence level. Remember what I said earlier? We do no more use addiction, but this time around we use what? Dependence, because addiction is derogatory. What then are the range of substances that can be abused? The range of substances that can be abused include what we call depressants, which is very common. And depressants are, examples include alcohol, which 90% of people use alcohol. 90% of people who use particular substances, alcohol is their main one. The other one too is prescription drugs, diazepam, midazolam, what people call blue, and the like, are examples of depressants. Then stimulants. Stimulants are, we have methylphenidate, we have methamphetamine, all of these things, ecstasy, all of these things are classified under the stimulants. Then we have tobacco, which is the common one that everybody knows about, which contains nicotine. Then we have cannabis, weed, ganja, Mary Jane. People have their ways of calling it. Then we also have the hallucinogens. The hallucinogens are the LSD, the PSP, all these ones. And the ones that you would notice that you go to a bar and then you see somebody, you see an adult grown-up man or woman blowing a balloon. In that balloon is a substance that they inhale. And this substance is either LSD or PSP. Then we also have the opioids and opioids. So the opiates are the natural products, whereas opioids are the synthetic manufactured ones. So we have pethidine and the like, all in this particular group, tramadol in this particular group. Then we have some other substances we call the legal highs. In the legal highs are synthetic substances that are manufactured in the lab purposely for use, for recreational use. We have what we call MCAT, people call it Mew Mew. Then we also have what some other substances we call synthetic cannabis or synthetic cannabinoids. And then we also have synthetic catinones. All of these ones, on the street, they ask peculiar names for these ones. Then we have some newer or novel substances that people abuse. People inhale glue. People inhale paint. People inhale, how do you call it? Fire extinguisher. All of these things, they contain some hydrocarbons that when you inhale, you get high on it. Then we have the energy drinks mixed with the opioid medications and all of these things that people can get high on. So the range of substances that can be abused are numerous. And if you looked at the topic that we spoke about substance and behavioral. Behaviors such as gambling, betting, you can also get addicted. You can also get dependent on these things. Behaviors such as sex, you can also get dependent on it. So we have people who have sex addiction, gambling addictions, and all of these things. So now we come to the pathophysiology. How come when Dr. Sedo here drinks alcohol, Sedo here has been drinking alcohol for a very long time, yet he is not dependent. But Dr. Azu goes to drink alcohol and gets dependent on it. The underlying factor is that every person's genetic makeup is different. Every person's genetic makeup is different. We have some people, by their nature of their genes, they are unable to break down some substances. By their nature of their genetic makeup, they are unable to metabolize certain substances. Or two, by the nature of their genetic makeup, they are vulnerable to being dependent. And so what may work for A may not work for the other person. And so it is important that we take note that although alcohol is not necessarily bad, we have some people, especially the Chinese and the Asians, there is a particular enzyme that breaks down alcohol. These people do not have that enzyme as compared to Africans. And so the little amount of substance they take, they become what? Intoxicated, and they are likely to get dependent from the use of this alcohol. But in general sense, for everybody who gets dependent on a particular substance, this is what happens. The body has its own natural mechanism where it rewards you for doing things that gives the body or makes the human body being survive. For instance, if you eat food, we have a particular substance called dopamine that is released in smaller amounts, which gives the body a sense of satisfaction. Your brain registers this, and therefore, anytime the brain starts to see the food, your eyes, you see the food, it knows that this particular food gives it what? A high. And therefore, you would go back again to eat it. And this is a natural mechanism that ensures that we survive. Because if we don't do that, people can go angry for a long time and die. Now, this is what happens if you take a substance. If you take a substance, for instance, cannabis causes this dopamine to be released in very higher amounts, 10 times the upper limit of what naturally would have been produced to give you that satisfaction and to ensure that the body goes back again for it. 10 times. With time, this natural reward process becomes disrupted. And because it gets disrupted, you need to now take more again in order to what? To get sensitized to this particular satisfaction. And in the early stages of dependence, take note of what happens. Someone decides that I'm going to take cannabis because the cannabis will make me high, to make me happy. Now, you are taking in cannabis. Cannabis makes you happy, gives you a lot of energy to be able to perform on stage or do whatever. This is what we call positive reinforcement. Positive reinforcement, because you are getting a reward of high energy, a reward of removing your anxiety away. But because with time, the natural reward process is broken and the pathway becomes disrupted, if you do not take a higher amount, you will not be able to get the high that you deserve. And this is when the tolerance begins to develop, because the body has become used to a particular amount. And now you need to take higher amounts in order to sensitize the body to produce more dopamine. Now, when dependence sets in, there is what we call negative reinforcement, where if you do not take the substance now, your natural mechanism of releasing the dopamine, remember, is 10 times more than the natural one. The natural one can no more gives you that satisfaction. And therefore, you begin to have the opposite effect of what the drug was giving you. Because you are now having the opposite effect of what the drug was giving you, you now begin to have certain symptoms and craving, which we call the withdrawal symptoms. Now, this time around, you are no more taking the drug to get the positive effect, but you are now taking the drug in order to prevent the negative symptoms that you were already getting. And this is what we call negative reinforcement. And at this particular point in time, people now take the alcohol or the cannabis in order to prevent withdrawal symptoms. This is when dependence what sets in. And this is the natural way and the natural mechanism in which people slowly get into what? Into dependence. I hope this explanation makes sense to you. Now, the question now is that if we find out that somebody is dependent on a particular substance, what do? We need to take a detailed history. And when I say a detailed history, I'm talking about spending at least 1 hour or 1 hour, 30 minutes with the patients, trying to find out a lot of things about the patient, family, education, and all of these things. Then we make a diagnosis. All dependents are not treated in the same way. If you are dependent on alcohol, your treatment is likely to differ from somebody who is dependent on cannabis. And at the time in which you are being examined, we would want to find out if you are currently in withdrawal symptoms, if you are currently intoxicated, if you are currently having a complication as in psychosis, and then we will treat it. So the diagnosis is very key to the management plan, because someone who comes in intoxication, the person's treatment is going to be different from somebody who comes and is in withdrawal. This is very important for us to know. Now, if you have made a diagnosis, what we are trying to find out is at which stage of change are you? When we talk about stages of change is a guideline we use to find out where the person is in terms of wanting to change from behavior A to behavior B. And so we have the pre-contemplation stage where the person has not even made a decision. The person is not even thinking of what cannabis is doing to the person. The person is in the mood and enjoying the use of the cannabis, enjoying the use of the alcohol. Then we have the contemplation stage, where for whatever reason, the person comes to a realization of what the cannabis is doing to the person and now begins to think about it actively. The person is now thinking, cannabis is doing this to me, cannabis is doing that to me. Should I change? Should I not change? Then person begins to what? To prepare to make a decision. That's the next stage. Then the person will now take a decision as to whether I want to stop using cannabis or I want to continue using cannabis. And if the person decides I want to continue using cannabis, the person has made a decision. If the person decides that I want to stop using cannabis, the person has made a decision to move to the next what? Stage, which is action. Action is when you then actively take in measures to stop the use of the substance, to stop the gambling, to stop the pornography addiction, to stop whatever you are dependent on. Action is when you now take measures by either putting off your phone at certain times, not being alone with your phone at certain times, or by not getting closer to people who are smoking cannabis, or by going to the hospital to make to get treatment. And this is the action stage. After the action stage will usually take about 6 months. After the action stage, the next stage is the stage of maintenance, where we now try to keep you in that stage of sobriety, in that stage where you do not use the substance or you are not involved in that particular behavior that you are dependent on. And there is a last stage where some people usually would add it, others would not add it, is the stage of relapse. That once you are in maintenance, you are like, you may go back to the use of the substance. It is not 100%. It's like you have gotten malaria today, you have been treated. You may get the malaria again. And that is the stage of what? Relapse. These stages of changes were professed by Prochaska and De Clementi. They brought about these stages of change. And so, if in the management, we notice that the person is in pre-contemplation, our goal is to do what we call an MI, motivational interview, to try and motivate the person to realize what the substance or what the pornography or what the sex addiction is doing to the person, and to move the person to what? To action. And when it comes to action stages in the hospital, we may decide to treat you on OPD basis or treat you at the rehab. On OPD basis, you may have what we call AA, Alcoholic Anonymous, or NA, Narcotic Anonymous, or we'll treat you in the rehab setting where you have an inpatient treatment with medications and with what we call the 12 steps to recovery. And our goal is that you become sober. Our goal is that you stop the use of the substances and still get the same desire and happiness that you were already getting. And this is very, very important. So, ladies and gentlemen, I would want to end my presentation at this particular point in time. And like I said earlier, addiction is so broad, but I tried to just summarize it a little bit for our understanding and for us to enter now into the discussion stage where we will discuss more. And then if there are any questions, you would ask me. Thank you very much for the audience. And thank you very much, Dr. Sedo here, my boss, for giving me the opportunity to educate people, especially during this month of mental health awareness. Thank you.
Thank you very much. And for everybody on the call, thank you Welcome to the new month. Happy new month to everybody. Yes, so it's time for questions and answers. He was very brief, so that if you have any questions, any further details that you may need, you can ask. Put your questions in the chat box or in the comment section, and he will gladly answer you. Yes, addiction is quite broad. There is both drug and behavioral addiction. He's explained how it happens, the various substances and the behaviors that people, it's quite a rising menace in our society. There are a lot of people who are now addicted to gambling, to sex, to pornography, to masturbation, to a lot of behavior, and of course, drugs, and it can go both ways. People can have behavioral and drug addiction as well. So if you have any questions, please drop your questions in a chat box, and Dr. Azu will gladly answer you. Please, thank you very much. Thank you very much. Thank you very much. Thank you very much. If you have any question, please drop it in a chat box. Drop it in the chat box. Dr. Azu tried to summarize everything so you know how it goes. And he also took us through what happens, and for you to know that there is help. All hope is not lost. If you should find yourself losing control over the use of any of the substances or any of the behaviors, there is help available. So please drop your questions in the chat box, in the comment section, and Dr. Azu will gladly answer you. Thank you very much. So somebody is asking, which one is more addictive? Is it cocaine or heroin? Somebody is asking, which one is more addicting, cocaine or heroin? Dr. Azu, over to you.
Thank you very much, Dr. Sodi here. I want to acknowledge the presence of my father, who is also my uncle, who is watching. He's in the person of Mr. Solomon Aswala. He's a very big man, and I'm glad to see
yes.
my uncle listening to me.
Yes.
And so the question with regards to which one is more addictive is a difficult call, and that we do not really have a range or a measure of addiction to say that one substance is more addictive than the other. However, there are individual factors, and there are factors of the particular substance that would predispose the person to being likely to be addicted. Heroin, for example, has a very shorter action lifespan. And so once you take in heroin, the effect of heroin is quick, in 30 minutes, 1 hour, and it's gone. Cocaine's effect is a bit prolonged and a bit longer. You understand what I'm trying to say? And so even in the heroin, there are some variants or some subtypes of the heroin that are even shorter acting than heroin itself. And so the shorter acting ones, you are more likely to get dependent to these ones. And again, like I said, there are a lot of other factors that are put into place to determine whether a substance is likely to be, somebody is likely to be addictive or not. One of these is age. Age is very important. Anyone who uses a particular substance, no matter whatever it is, before the person turns 15, 18, is more likely to get dependent than somebody who starts using it in his 20s. Yeah, so these are some of the things that you can use to determine how likely a person is going to be dependent on a substance.
All right. Thank you very much, Dr. Azu. There's another question. Somebody says you should go over the natural reward reinforcement. Kindly go over it shortly. Somebody is asking.
All right.
Natural reinforcement. Natural
so
reward
with the natural, so this is what we call the reward pathway. The reward pathway, basically, the body will reward you for doing something that keeps it in homeostasis. The body would reward you for doing something that keeps it in a survival mode. Example, you eat, and once you eat, you notice an angry man, or my wife always tells me I cannot pronounce angry and angry. But an angry man, obia a common edeno, is somebody who can easily get angered. But
A
after
hungry
the
man is
person
an
has,
angry man.
yes, an angry man is an angry man. So after the person has eaten, you notice that exuberance, that happiness in the person. This is what something everybody sees it. Somebody who is yearning for sex, after the sexual encounter, you notice some form of happiness within this particular person. You understand? The reason for this happiness is because of a particular substance we call dopamine. So dopamine is released, which makes the person or gives that person that form of happiness and that form of high. And this is the natural reward pathway. And it encourages us to go and continue to do these things to keep it in survival mode. However, we have learned that there are substances that would increase the dopamine level to about 10 times its usual. And so when you take things that will now give you 10 times the usual amount, what that simply means is that you are likely to go immediately for that particular substance than to say you are going to do physical exercise, than to say you are going to eat food. That is what the natural reward pathway is. And again, the body puts it in a form in memory. The part of the body that does that is what we call the amygdala. So it puts it in memory. So anytime the body sees it, the body recollects the happiness that it gave him. And so somebody who is taking cannabis knows that cannabis does this to you, and the body itself knows that this is what cannabis has done to me. So you are likely to go in for the cannabis. And this is what the reward pathway is, and this is what it does.
All right, so there's another question. It's about the medication-assisted therapy. The person is asking a very, very brilliant question. The person says that opioid substitution, all right, the OST, opioid substitution therapy, where we use methadone and buprenorphine, later on, there's also risk of dependence on these drugs, methadone and buprenorphine. What is your view? Are you for or against, or you are neutral?
Yeah. So, yeah, in fact, I am, that, learning from our senior colleagues in the profession, some people are against the use of methadone. However, my opinion is this, and this is, let me explain what methadone does to some people who do not understand. So we have petidine, somebody who is taking petidine, somebody who is taking tramadol. When you take tramadol in very high doses, it can make you get into respiratory depression. Its effect is dire. It can kill you very quickly. And so substitution therapy basically says that in place of a substance that is more toxic, we would give you another substance that is closer to it, does not give you the same higher effect as the petidine, but its effect is closer to the petidine. And therefore, we will give you what? The methadone. And that is the goal of substitution therapy. And that's why you would give somebody methadone or buprenorphine. And note, methadone, you can go into very higher amounts than petidine. And the goal of substitution therapy is not to maintain the person for life on the methadone. Gradually, you would what? Reduce the amount and wean the person off the methadone. For me, I am all against anything that you would take that would give you the same effect or a closer effect and not cause much damage than the one that would cause more damage to you. And Accra Psychiatry Hospital have started a study and a research to try and liaise with Ghana Standards Authority and Narcotics Control Board to bring methadone for us to start methadone substitution therapy. It's still in the pipeline, and it's something that we are hoping that in the next few years we'll be able to do that. So for me, I am for methadone substitution therapy.
Yeah, so just like he rightly said, the aim is not to get you to become dependent on methadone. It's just to have you take something that can be controlled. And you don't just take it on your own. You have to go to the clinic every day to take it from the prescriber directly. So it is directly monitored. And the aim, like he rightly said, it to be reduced after some time. Thank you very much. If you have any questions, please drop it in the chat box, in the comment section. And Dr. Azu is answering all our questions. Please, if you have any questions, drop it in the chat box, and Dr. Azu will answer all our questions. If you have any question. And one question, Dr. Azu, if somebody has a behavioral addiction, what will you advise? Sex addiction or say gambling addiction, what will you advise? And what's the help available in Ghana for such a person?
Yeah. So, I mean, the good news is that there is help available for the person. And like I said, anybody who has a behavioral addiction, sex addiction, or gambling addiction, we would advise that you come to the hospital for, like, remember I said that in the management, we need to take a detailed history. The detailed history would help us identify your peculiar predisposing factors. That is the baseline factors that you have that has made you dependent on it. And then precipitating factors, those factors that have made you enter into the particular behavior. These baseline history helps us to counsel you. They help us to give you a client-centered therapy that is centered to you, because it is not one club fits all, that everybody who has gambling addiction, we need to do this for the person, and then the person would recover from it. The therapy needs to be focused and to the person. And we also have group therapies that you can join to help you. But then generally, anybody who has, for instance, gambling dependence, the advice is that, first of all, number one, it depends. Is the person gambling at the lotto kiosk or the person is gambling on the phone? The first thing that you need to do is that you need to delete all the gambling apps. And there are various inbuilt mechanisms in the phone that prevent you from going into any website that is better. So you activate these ones in order to prevent you from going into any of the apps. That's number one. Then you need to get a support system who would guide you and help you and prevent you from using any of these things and monitor your phone. Same with somebody who is a sex addict. You don't get yourself exposed to things that will trigger you into having sex, be it being in a club, be it being on Oxford Street at certain times of the night, and all of these things. So these are general things that we can. But the most important thing is that once you come into the hospital and we take a detailed history, we'll be able to help you and then give you psychotherapy that is tailored towards your needs.
All right. Thank you very much. Thank you very much. Does anyone else have any other question before we allow Dr. Azu to go on with his work? Anyone else has any other question?
Wisdom is asking a question. Wisdom is my very good.
Asking, gambling addiction is a menace. Are there plans by the Mental Health Authority to ensure there are measures to safeguard gambling addicts in terms of policy?
Yeah, this is a very good question, but unfortunately, it is above my pay grade. That So, in terms of to ensure that there are more measures to safeguard gambling addicts, you see, I mean, the good thing is that if you're a gambling addict, the Mental Health Authority says that we are available to help you. Come to any of our facilities and we'll be able to help you. But in terms of policy, I am not aware of any policies that are being taken currently to Parliament for policies to be made in terms of I'm not aware of any of these policies.
All right. So what I know,
Dr. Sedu here, you can also come in.
Yeah, what I know from the practice is that the gambling apps have inbuilt mechanisms where you can exclude yourself for a number of months or years, you go tell the app that I don't want to gamble anymore and I'm addicted. I will not gamble again for the next 10 years or 5 years or 2 years. When it happens like that, when you take the app to want to gamble, it will not allow you. That's the first level. Then the higher level is that you can actually reach out to Ghana Gaming Commission. When you reach out to Ghana Gaming Commission and you give them all your details, they will have your details and then deactivate you from every gambling platform in the country. So I have a client like that who has done that, and that's the only way he's been able to stop the gambling. Do you understand? So you contact Ghana Gaming Commission and they take your details, the same detail that you'll be entering your apps with, then
Your
they
email,
deactivate you,
your
like they
name.
blacklist you. So you are blacklisted from using any gaming app in the country. So even if you take your phone and you put in your name and your number and whatever, because you have to put in those details for them to accept you before you can start gambling. So if whatever happens. So there are ways to, that is if you are even conscious of what is going on. Most of the gambling addicts are not even aware that there's a problem. They just keep chasing the next win, which always keep eluding them. So there are ways that you can seek help. So you know you are addicted to gambling. You've tried everything, but looking at the app, there are ways you can exclude yourself. And then you can go higher to Gaming Commission and they will blacklist you from gambling in Ghana. So yes, there are policies already. MHA is treating addiction as general, whether behavioral or drugs. Again, like Dr. Azu said, you go to the hospital, you are fully assessed, and a plan is drawn specifically for you. There's therapy sessions, there is rehab processes that you go through to help you with the behavioral modification. It's not a one-size-fits-all, and it's not a one-off thing. It's a process you have to go through. And you are always going to be referred to as a recovering addict, which means you take it one day at a time. So yes, so that's what I can say to that, to Wisdom's question. Any other question? Any other question before Dr. Azu is allowed to go on with his work? Thank you very much, Dr. Azu. It's been very insightful and people enjoyed the session. And I'm happy about the gambling question as well. And of course, the other ones as well. What we all know is it is rising and people need to know. And it was good that you let them understand how it starts. You know, the reinforcement, the negative reinforcement, the positive reinforcement, and all the dopamine and all that. So, yes, so somebody says, your uncle is saying he's happy to have joined the session. Yes. So what you can do for us, every one of us on this call, is you can subscribe to the YouTube channel and you can share. The YouTube channel is Dr. Albert Sedo here. You can subscribe, put the notifications button on. I will upload this recording in about 30 minutes, 15 minutes or 30 minutes time. You can share and have as many people also benefit from the wonderful presentation by our wonderful Dr. E.A. Asusong. Dr. Azu, what will be your final words to all of us, knowing very well that there is a rising menace of behavioral and drug addiction in Ghana?
Yeah, so my final words are that we need to be self-aware. We need to be aware of ourselves. Self-awareness in 3 main domains. And I would say this, 3 main domains. Self-awareness in your thoughts. You know, the kind of thoughts, the kind of things you think about. Self-awareness in terms of your emotions. You know, how you have been feeling. And then lastly, how you have been behaving. If you notice that your behavior is being now dependent on a particular thing, including Coca-Cola, energy drinks, anything that you take from outside in order for you to be able to survive or for you to be able to engage in your daily activities, know that you are on your way to what? To dependence. And as a general rule, if you notice any change in your way of thinking, in your way of behaving, and in your way of emotions, know that help is what available for us. And I would end with this particular quote that it says that humankind cannot bear very much reality. In fact, we cannot bear very much reality. And that is the reason why we would always want to take in substances in order for us to be able to face reality. And he says that it is the urge to escape the longing, to transcend themselves, if only for a few minutes, is and always has been one of the principal appetites of the soul. It is the main reason why a lot of people want to engage in substances in order for them to escape reality. But then again, I say that you can try as much as possible to escape reality without endangering yourself or harming yourself. On this note, I would want to say thank you to all the listeners and thank you to Dr. Sedo here. Please let us go to YouTube and subscribe to Dr. Sedo here's YouTube page. It contains messages from all various health professionals. Please let us go to YouTube and then subscribe and then share to all our contacts. Thank you very much, Dr. Sedo.
Thank you very much, Dr. Azu. Thank you very much. Yes, so the YouTube channel, Dr. Albasani, I've shared it in a chat box on Zoom. Again, we have a lot of content there. A lot of medical specialists have been hosted here, and it's all recorded and it's all there for your consumption. You want to know more about depression, anxiety, whatever you want to know, it's there. We've done infertility. A lot of topics have already been handled. So it's in your best interest to go check it out and subscribe, put the notifications button on, and most importantly, please help us share with as many people as possible. We want people to have accurate information, not from people who are not qualified to be advising you. Thank you very much for making time to join today's Weekend Health Talk, and we are much grateful to Dr. E.A. Azusong, who made time to serve us. Thank you very much. Until I come your way once again, it's been a pleasing pleasure serving you all. Let's all enjoy our afternoon, morning, or evening based on where you're reaching us from. Thank you very much.